Here's something that should bother you. The average annual physical in America includes a blood panel that tests for fewer than 25 biomarkers. Meanwhile, research tells us there's over 100 measurable signals in your blood that predict cardiovascular disease, cognitive decline, hormone dysfunction, nutrient deficiencies, and accelerated aging, years before symptoms show up. So when your doctor calls and says everything looks normal, what they're actually saying is, the 20 things we checked look okay, but the other 80 we didn't look. I'm Dr. Trevor Turner. I'm a precision longevity physician at Pravida Health in Atlanta, and today I'm going to walk you through exactly what's missing from your standard blood work and what a comprehensive longevity panel actually shows. Let's start with what you're probably getting right now, a standard metabolic panel. What most PCPs run at an annual physical covers basic organ function: kidney function, liver enzymes, blood sugar, electrolytes. A CBC tells you whether your blood cells look roughly normal, and a lipid panel gives you total cholesterol, LDL, HDL, triglycerides, and that's pretty much it. Now I want to be clear, this is not me criticizing your primary care doctor. They're working within a system and they have an average of 7 minutes or less per patient. Insurance, reimbursement constraints, and clinical guidelines that were written for population-level disease screening, not individual health optimization. But there's a fundamental difference between screening for disease and optimizing for longevity. One asks, is anything catastrophically wrong right now? And the other asks, what trajectory are you on and can we change it? Here's what most people get wrong. They conflate the absence of a flag on a standard lab with the absence of a problem. But those are not the same thing. A classic example is LDL cholesterol. Standard panels report total LDL, but LDL is not one thing. It's a spectrum of particle sizes and subtypes. Small, dense LDL particles are roughly 3 times more atherogenic than large, fluffy LDL particles. So two people can have exactly the same total LDL number with completely different cardiovascular risk profiles. But if you're only measuring total LDL, you're flying partially blind. So what should comprehensive longevity testing actually cover? In my practice, we organize it into 5 major categories. Category 1, advanced cardiovascular markers. Beyond basic lipids, we're looking at ApoB, which directly measures the number of atherogenic particles in circulation. It's a better predictor of heart attack risk than LDL-C in most patients, but most standard panels don't run it. We're also running Lp(a) or lipoprotein A, a genetically determined cardiovascular risk factor that roughly 20% of people have elevated, and most of them have never been tested for it. Homocysteine, oxidized LDL, high sensitivity CRP. These aren't exotic tests, they're just not on the standard panel. Estradiol and progesterone for women and cortisol patterns. Hormones are your body's operating system. Running an incomplete panel is like checking whether your phone is on and ignoring everything else. Category 3 is micronutrient status. This one surprises people. Vitamin D is the obvious one. Roughly 40% of Americans are deficient, but we go much further. Magnesium intracellular, not serum, because serum magnesium is almost always normal even in people who are functionally depleted. Zinc, copper, selenium, and iodine, omega-3 fatty acid index, B12 and folate with methylation markers. Why does this matter for longevity? Because micronutrients are cofactors for virtually every major metabolic process in your body. Mitochondrial function, DNA repair, neurotransmitter synthesis, all of it runs on nutrients. Deficiencies don't usually announce themselves dramatically. They just quietly degrade your function over years. Category 4, inflammatory and immune markers. We're looking at a full inflammatory picture. High sensitivity CRP, of course, but also IL-6, TNF-alpha, and ferritin as an acute phase reactant and not just an iron marker. And fibrinogen. Chronic low-grade inflammation is the common denominator underlying nearly every age-related disease. You need to know where you stand. In Category 5, metabolic health beyond glucose. Fasting insulin, not just fasting glucose. You can have a completely normal fasting glucose with a significantly elevated fasting insulin, which is an early signal of insulin resistance that typically precedes type 2 diabetes by years to decades. HOMA-IR, uric acid A1C with the context of red blood cell lifespan, and at the signature level of our work, we layer in metabolomics, a snapshot of hundreds of metabolic byproducts in your blood that reveal how your cells are actually running at the molecular level. Here's where I want to spend a few minutes because this is genuinely important and I don't think most people understand it. Every lab comes with a reference range. Those ranges are typically calculated from a population of people who were tested at the lab, a bell curve, of values of people who are, quote, healthy, but in practice, that often includes people with subclinical disease, people who are overweight and with metabolic dysfunction. And the reference range is not an optimal range, it's a normal range, as in most people are in the range. Take vitamin D. The conventional deficiency threshold is typically set at 20 nanograms per milliliter, but most longevity-focused physicians and most of the relevant research literature targets 50 to 70 for optimal immune function, bone health, and cardiometabolic benefit. Those are very different numbers. A result of 22 is normal on standard lab criteria and simultaneously inadequate by functional criteria. Or take free testosterone in men. Reference range for a 50-year-old might be anywhere from 3 to 22, which is a nearly 8-fold difference. A man with free testosterone at 3 is technically normal and experiencing symptoms. Fatigue, poor body composition, cognitive fog, low libido, those are directly attributable to low testosterone. The number was never the problem, but the interpretation was. This is exactly why I insist that data without clinical context is noise. The direct-to-consumer lab testing market just crossed $3 billion in annual revenue. People are buying their own panels, uploading them into apps, and trying to interpret them without medical training. Some of that is fine, but a lot of it leads to unnecessary anxiety or false reassurance. The value of working with a longevity precision medicine physician isn't just the data. It's the pattern recognition across all of those data points simultaneously, combined with your history, symptoms, genetics, and goals. Let me walk you through a composite example. Not a real patient, but a representative picture of what I see regularly. Imagine a 47-year-old male executive. Annual physicals are always normal. He feels generally okay, but notices increasing fatigue and a few extra pounds that won't move despite reasonable effort. And his mental sharpness feels like it's down 15%. His PCP tells him everything looks fine, so he comes to us. We run a comprehensive panel. Here's what we find. His ApoB is elevated to 130. His cardiovascular risk is hiding behind a normal LDL. His fasting insulin's at 18, early insulin resistance signs with glucose still technically normal at 94. Free testosterone 7.2, technically in range but functionally suboptimal for his age and symptom burden. Intracellular magnesium's deficient, omega-3 index is 4.3%, well below the 8% target associated with cardiovascular and cognitive protection. Homocysteine is at 16, elevated, indicating methylation pathway stress, and independently associated with cognitive decline and cardiovascular disease. And vitamin D at 24 is called normal, but is functionally inadequate. Every single one of these results was within the reference range or close enough to be unreported. What does this tell us? That this man is on a trajectory toward accelerated cardiovascular aging, insulin resistance progression, cognitive decline, and hormone dysfunction. And a standard annual panel would have sent him home with a clean bill of health. The intervention in a case like this is not complicated. Targeted supplementation, dietary adjustments, and exercise prescription focused on a mix of zone 2 cardio, high-intensity intervals, resistance training, and close monitoring. But none of that happens if you never measure the right things. At Pravida Health, comprehensive biomarker testing is the foundation of everything we do. We layer this data onto your whole genome sequence so we can see not just where your biomarkers are today, but which genetic variants shape your individual response to nutrients, medications, hormones, and exercise. We integrate DEXA scan data for body composition, VO2 max testing for cardiorespiratory fitness, and OxFit testing for functional strength. And at the signature level, we add metabolomics, proteomics, and environmental toxin screening. The output of all of that is not a PDF report, it's a conversation. A 90-minute interpretation session with me where we go through what every meaningful finding indicates and what your risk trajectory looks like, and exactly what we're going to do about it, with specific interventions tied to specific biomarkers, tracked over time at regular intervals. That's precision medicine, not a panel, a plan. If you've made it this far, you clearly care about understanding your health at a deeper level than everything looks normal. So here's what I want you to do. In the comments below, tell me what's one test you wish your doctor had run that they never ordered. I read every comment and I'll answer as many as I can. Your question might turn into the next video. If this was useful, subscribe. I post every week on longevity medicine, precision testing, and evidence-based strategies to extend a health span. Hit the notification bell so you don't miss it. And if you're in the Atlanta area and want to actually get this kind of comprehensive panel done, there's a link in the description to book a consultation at Pravida Health. We take a limited number of new patients each month, so if you're interested, don't wait. The link to the full blog post version of this content is also in the description. It goes deeper on the specific markers and the research behind them. I'll see you in the next one. Thank you.